Good afternoon, everybody. My name is Scarlett Martin, and I'm the Director for the Department of Metropolitan Development. I could not be more pleased to join Mayor Hogsett and the Near North community today for this exciting announcement. Lift Indy is Mayor Hogsett's innovative approach to transforming our neighborhoods, and it's about making thoughtful and impactful change, making the biggest impact from our limited resources, and prioritizing our investments in a way that will result in sustainable change. To talk more about that, it is my honor to introduce Mayor Joe Hogsett.
Well, thank you, Director Martin. That's got a nice ring to it. Director Martin, congratulations, Scarlett. Each year since 2017, the city of Indianapolis has designated a new Lift Indy area through a data-driven and competitive process. So today, it is indeed my honor to announce the Near North Corridor as the newest Lift Indy neighborhood. As with everything in 2020, we took a unique approach in the expansion of the program this year. Primarily, we adapted the application process to focus on projects that can respond to the public health crisis. There's no doubt that our neighborhoods are resilient and will bounce back. But the city must take the resources that it has at its disposal to achieve the biggest positive impact possible. As a Lift Indy neighborhood, the Near North will receive a portion of 2 U.S. Department of Housing and Urban Development grants. The Home Investment Partnership Program and the Community Development Block Grant. Those grants come with a 3-year commitment to building up community resources that make for great neighborhoods. Things like economic development, placemaking, affordable housing, infrastructure, and more. Past Lift Indy neighborhoods, just to remind you, Monon 16, the old South Side, and East 10th Street, those neighborhoods have already seen the benefits of the Lift Indy investments. New facilities taking the place of vacant lots or dilapidated structures, park improvements and gathering areas, and most importantly, targeted investment that allows a neighborhood to realize its potential without losing its affordability for multi-generational long-term residents. As I said, this year we chose to expand Lift Indy's capacity. As a result, for the first time ever, we will announce a second Lift Indy neighborhood in the new year. So, as a teaser, stay tuned. I want to thank the partners who worked to make DMD's efforts a reality, and those particularly who worked with DMD's community investments team to make a special edition of Lift Indy possible. And those partners include the Polis Center at IUPUI, and of course, the Near North Development Corporation and their partners, including IU Health, We Bloom, Indiana Plan, Indianapolis Neighborhood Housing Partnership, the Indiana Housing and Community Development Authority, and last but certainly not least, the Meridian Highland Neighborhood Association. This is an exciting announcement for Near North, for our neighborhoods generally, and for the city of Indianapolis. It's further evidence that even in the most difficult times, some of the most trying times our city has faced. We continue to grow, we continue to build, we continue to improve. So I thank you very much.
Thank you, Mayor Hogsett. Our next speaker has been leading revitalization efforts on the Near North Side for 13 years. He has 36 years of experience in real estate development, finance, and brokerage, including 2 decades in the public and nonprofit sectors, during which he has been responsible for more than $75 million in affordable housing, economic development, and urban redevelopment projects. It is now my pleasure to introduce President of the Near North Development Corporation, Michael Osborne.
Thank you. Thank you. Good afternoon. Thank you, Scarlett. And thank you, Mayor Hogsett, for your selection of Near North, for your confidence in our organization and our partners, and for your investment in this place, its people, and its future, really. As Scarlett said, I've been with the organization 13 years, and while I'm really proud of the work we've done, the impact we've had during that time, I really do believe that some of our most exciting years are ahead of us as we, as an organization, refocus on the place we came from, the Near North Corridor. With its proximity to downtown, the new Red Line, amenities like the Fall Creek Greenway, and not least of which a new Methodist hospital on the way, the corridor is already attracting private investment, already attracting development, and the pace of transformation is only going to increase in the coming years. And so not only will the Lift Indy's investment in affordable housing and job training and supportive services help address the disproportionate impacts of the pandemic on our most vulnerable citizens today, but importantly, it will also help ensure that the corridor is a place of diversity, inclusivity, and socioeconomic opportunity for everyone tomorrow. We're very proud to lead a team of very high-performing organizations doing a lot of diverse and interconnected things to benefit the community. From Near North standpoint, with the Lift Indy support and partners like INHP, IU Health, and others, Near North will invest nearly $40 million in the next 3 years in development of the Excelsior and Capitol Gardens on long vacant properties in the corridor, creating 220 new units of rental and ownership housing in the corridor. And while I'll admit our work as an organization may be more about the brick and mortar development side of community development, at the end of the day, we know it's not about the projects themselves, but about the contribution to the quality of life that those projects provide to the people in the community that we serve. So the Excelsior and Capitol Gardens are not just creating new housing. It will create new affordable housing opportunities specifically for lower and middle income workforce in the corridor. Through their design, materials, amenities, and active programming, they will be showcases for healthy housing. And with retail space, public gardens, and a new community center, there'll be physical hubs of neighborhood activity and a platform for neighborhood services for years to come. So again, thank you to Mayor Hogsett, to the city for your support, your confidence, and your partnership. Thank you.
Thank you, Michael. Our next speaker is a lifelong Indianapolis resident. Her passion for lifting the community focuses on child welfare, prevention services, youth mentoring, community outreach, and recovery support. It's my pleasure to introduce We Bloom's Program Manager for Recovery Cafe, Camille Anderson.
Thank you for that introduction, Director Martin. Acceptance, community, connection, belief, hope, opportunity, growth, and love are all the words that Member has used to explain why they remain connected to the Recovery Cafe Indy. Our mission is to support the development of the mind, body, and spirit of individuals desiring recovery. By creating a community committed to love, support, equality, and inclusion, we provide a space that will support all aspects of recovery. Our vision is through a connected community, members will sustain long-term recovery. The goal is not simply survival, but developing thriving members who reach their full potential. Our goal is to remove the stigma of recovery by building an inclusive community in which we all see each other as human beings on a journey of growth and change, all recovering from whatever keeps us from being our best and truest self. It doesn't matter if you're recovering from substance use, mental health, trauma, incarceration, or just recovering from the hardships of life, you are welcome at the Recovery Cafe. At the heart of our mission is connection. Connection to resources, connection to community, connection to purpose, and most importantly, connection to self. Partnering with organizations such as IU Health, the Indiana Plan, and Near North Development on this Lift Indy grant means that we all share the common belief in the value of connection. Being awarded this grant means our city shares this vision as well. We all know that connection is needed more than ever before. This year has challenged us all in more ways than we ever imagined, causing extreme social isolation, disconnection, and loss. In our community, we are seeing increases in homelessness, loss, trauma, mental health triggers, and substance use relapse. As a community, we're all recovering from COVID-19. This Lift Indy grant provides us at the Recovery Cafe the opportunity to do exactly what the title states, to lift Indy by restoring connection and showing that recovery is possible for all. This grant allows us to increase access to resources for underserved community, including access to peer recovery support, building community connections by partnering with local nonprofits and minority-led businesses, and provide direct support opportunities through our School for Recovery that encourage growth, promote social emotional health, and economic advancement through projects such as our culinary and barista program funded by this Lift Indy grant. Through our culinary and barista program, we're able to provide free job training and teach skills focused on health and nutrition while providing opportunities that promote entrepreneurship. And this is just one of the programs that we are able to introduce through this grant. This grant funding also provides us with the ability to create a beautiful space as a new home for Recovery Cafe Indy at the Mosaic Center. This increases our capacity to offer a safe space where recovery, community connection, and new opportunities merge, and a place where love is fuel so that healing in our community is possible. This grant supports the overall recovery of our community as a whole. One stated, "We get sick alone, but we heal together." Again, my name is Camille Anderson, and I am honored that we are a part of the recipients of the 2020 LIFT grant. Thank you.
Thank you, Camille. Our next speaker is also a lifelong Indianapolis resident and has served as the executive director of Indiana Plan for the past 6 years. He completed their 2-week training program in 1996 and spent 21 years as an electrician with the IBEW Local 481 before returning to lead the program. It is now my pleasure to introduce Devin Doss.
My name is Devin Doss, and with the Indiana Plan. Our mission is to increase the number of women, minorities, disadvantaged workers, women, minorities, disadvantaged workers, underemployed, and ex-offenders in the skilled trade construction industry. With this grant, just like other outreach programs in the community, one of our main goals, along with administering help for the community, is also figuring out ways to enhance our program. And definitely during these trying times with COVID, everything that's going on with construction and the industry alone, our main thing is to how can we administer this program and how can we enhance it. With this type of grant, it's going to allow us to do that. Partnering with the organizations that are on this grant, along with Recovering Cafe, is going to give the participants that go through our program other opportunities for help or just expanding. We are, wait, I lost my note. I apologize. Again, that is Indiana Plan, being around since 1970, has been a big organization in the city of Indianapolis. Me myself, coming from Indianapolis, it was something that really helped me get an opportunity to have a career. Again, going back to something that the mayor said with the ABCs is a job, a better job, and then a career. In the construction industry, it is something that once you get into that, to get a skill set will help you get that career that you need. And so with this type of grant, again, just like other community organizations, we want to look at opportunities to be able to enhance our programs, and this grant is definitely doing that. So on behalf of the Indiana Plan Board of Directors and myself, I want to thank Mayor Hogsett, IU Health, and everybody involved with this grant.
And thank you, Devin. Our final speaker is the President and Chief Executive Officer for IU Health. He joined the team in 2013 as Chief Operating Officer, overseeing the operation of IU Health entities throughout the system. An experienced healthcare executive, he came to Indianapolis from Northwestern Memorial Healthcare in Chicago. I'm excited to invite Dennis Murphy to share some words.
Thank you, Scarlett. My name is Dennis Murphy, and I'm the President and CEO of IU Health. It's a pleasure to join our partners in this initiative to enhance the well-being of the Near North neighborhood. I can say with complete assurance that an economically healthy community plays an important part in the physical health of our communities. It is why IU Health is committed to supporting the Near North neighborhood. We realize that this community surrounding our Methodist Hospital campus doesn't begin or end at our physician's office or our hospital. This Lift Indy initiative will help address social impediments like affordable housing and career development that have such huge impacts on the quality of the lives of our neighborhood and the people who live in that neighborhood. As an anchor institution in the Near North, IU Health will contribute money and other resources to supplement the Lift Indy program that is being announced today. We will help fund 2 affordable housing developments next to our Methodist campus. We will also contribute to other improvement projects in our neighborhood. Our Methodist campus is growing. We will soon start construction on the new hospital along 16th Street. It will be the most extensive project that IU Health has ever undertaken and a critically important one for the city of Indianapolis. We look forward to partnering with Near North and the city as our new hospital and our extended campus take shape, and to contributing to the vitality of the Near North neighborhood. IU Health will remain an active partner in fostering more work opportunities, more housing choices, and healthier lifestyles in our Near North neighborhood and community. We look forward to seeing the exciting progress outlined here today become a reality tomorrow. Thank you so much, Scarlett.
Thank you, Dennis. And I'd like to thank everyone for joining us today and just take a quick moment to thank a few members of our DMD Community Investments team, including Jenny Foltz, Beth Neville, and Costin Ritter, who have worked very hard on putting together this announcement, and we'll work very hard with the community leaders represented here over the next few years to bring these transformative projects to life. So thank you very much.
Thanks, Scarlett. I think we'll now move on to our question and answer portion of the press conference. As always, reporters are encouraged to put their name and outlet in the Q&A box, and then I'll unmute and call on reporters on a first come, first served basis. So we'll pause a minute to give them time to do that. All right, our first question is from Alexandria Burris of Indy Star.
Hi. Can you speak a bit more about how the pandemic has specifically impacted the Near North neighborhood? And I wasn't able to put this in the chat because I ran out of space, but how does that compare to what you're seeing in other parts of the city? And what percentage of the grants will go toward that neighborhood?
Do you want me to kick that off, Mark? And then I'll ask the partners to jump in. So Near North will receive approximately $3.5 million of our home and CDBG HUD programs this year. Because of the COVID-19 crisis, we actually decided to change our plan just a little bit from previous years when we've selected just one Lift Indy neighborhood. So with the help of the Polis Center at IUPUI, we were able to develop some data that demonstrated neighborhoods that were particularly impacted by the crisis. And we decided to select 2 neighborhoods, which Mayor Hogsett alluded to, that we would have a subsequent announcement soon. I would ask my my colleagues to speak a little bit about the Near North neighborhood and specifically how it may have impacted this area. So, Michael, I don't know if you want to kick us off a little bit.
There you go, unmuted. Actually, I think in terms of the impact on the people, I think folks like Camille probably have a really, really good perspective because they serve folks across the city and can compare and contrast. I will emphasize that while COVID is dominating everyone's life these days, oddly, in thinking about this proposal and the work we wanted to do and being responsive, in some ways, the COVID crisis didn't create new problems. It exacerbated the challenges that, the folks we all try to serve and the communities we all serve, it just exacerbated and magnified a lot of those problems amongst the same people. So I'm not sure that new challenges came up. They're just a lot bigger challenges, but maybe, Camille, you can talk to that and I can come back to some of the money part.
Yes, as stated, we are definitely seeing increases in the areas of homelessness, mental health trigger, also substance use relapse, more calls to the emergency rooms, more individuals reaching out and seeking help. And also it has tremendously impacted our low income community as well. We are seeing increases in homelessness, more families dealing with homelessness. And then also just with the homeless population that we already had, it did just lift the veil on some of the issues, that we're having. So to have a place where, like the Mosaic Center, where we will be located is going to be essential for us to recover as a community, to bring and build those bridges of resources by bringing organizations together such as IU Health and Recovery Cafe and the Indiana Plan. We're responsive to those needs. Again, us at the Recovery Cafe, we provide overall recovery support. So anyone who has been impacted, anyone who identifies as being in recovery from whatever you're recovering from loss, a job loss, trauma, mental health, addiction, it doesn't matter. You're welcome at the cafe. And this is a place where you can get encouragement, you can get hope, you get opportunities for job training and programs focused on social and emotional health, while also getting access to services such as the construction programs through the Indiana Plan, and then all the services offered through IU Health. They're going to focus a lot on children and providing that support for them as well, along with their other services. So we're seeing an impact on our community, and as Michael stated, it is really some issues that we've had. It's just kind of lifted the veil for it to become more visible for our underserved communities.
And maybe to echo some comments from Michael and Camille, I think Michael's comment that the pandemic exposed probably what was pre-existing. I think this community has probably a much higher percentage of essential workers than most other neighborhoods, which means they've been on the front lines of the pandemic, whether that's working in healthcare, whether that's working in service industries that didn't stop working during the pandemic, which also then exposed them potentially to more risks. There's strong data that households in communities like Near North have a higher percentage of people who had to come home after working and therefore potentially expose their families. So I think what we've learned is how important the people in this neighborhood are to not just the Near North community, but to the entire city of Indianapolis and the state. and that we need to make sure that they have a vibrant community to come back to, one where their kids have great schools, where they have access to technology if they need to work from home for their schooling, that they have job opportunities. And so for us, the pandemic has really just created a renewed urgency on how we work with our partners to improve this neighborhood. It just laid bare what we always knew and felt. And I think it's important for us to get going.
All right. Looks like that might be, you guys are very thorough, so I'll maybe filibuster one quick sec while we give any more time. But to all the panelists, thanks again for joining us. And we do have a press release that will be sent out following this with a little more detail, as well as some links to the Lift Indy site. And all reporters are welcome to reach out for any further questions as some of these initiatives get underway. All right, thanks everybody for joining us, and we'll see you soon.